Good morning, all the second student. Today we will continue the sulfonamides. Last time you can see the sulfonamides. Sulfonamide found discovered in 1932. It was discovered by Domack. Previous lecture I told to you. And the sulfonamide act as an antimicrobial activity. Is act as an antimicrobial activity. Antimicrobial activity. Sulfonamide insoluble in the water, but along with the sodium salt, it's soluble in the water. Sulfonamide is act as a antimicrobial activity. Sulfonamide basically act as a bacteriostatic. Bacteriostatic means they stop the growth of microorganism. That is called the bacteriostatic. Against sulfonamide act as antimicrobial activity is act in the bacteriostatic activity. They stop the growth of bacteria or inhibit the growth of bacteria. The sulfonamide act as a bacteriostatic. Basically, in the many gram positive bacteria and gram negative bacteria, but it is not effective against sulfonamide not effective for tuberculosis and leprosy They are also not effective against fungi, yeast and virus. Now is the sulfonamides. Now to see the mechanism of action. Some bacteria cannot absorb folic acid and depend on their ability of synthesis of the folic acid by para-aminobenzoic acid. Now, para-aminobenzoic acid now sulfonamides, how they inhibits. Sulfonamide is inhibited to the dihydrofolic acid converted to the tetrahydrofolic acid and to form folic acid. Folic acid is essential for is essential for formation of new cell. The sulfonamides now the folate synthetase and folate reductase. Now see some mechanism of action of sulfonamides. Some bacteria cannot absorb folic acid, depend on their ability synthesis of folic acid from para-amino benzoic acids, and the folic acid responsible formation of the new cells. Now here para-amino benzoic acid to form dihydrofolate converted to the tetrahydrofluorate in the presence of enzyme folate synthesis. Tetrahydrofluorate converted to the folic acid folate reductase and the folic acid formation of the new cells. Now here is how the sulfonamide is act. Sulfonamide is inhibit. Now that stage, that indication. Sulfonamide inhibit this side indicate the inhibition. Which stage? Dihydrofolate converted to the tetrahydrofluorate, means does not form the folic acid, does not produce the new cell. That is the mechanism of the synthesis. The structural similarity between now mechanism of action. This is the mechanism of action of sulfonamides. The structure of sulfonamides resembles PABA. PABA means this para amino benzoic acid. Structure resemble to para amino benzoic acids. And they compete with the enzyme folate synthetase. They compete the folate synthesis, preventing the formation of folic acids. Now see how they are at formation of folic acid. And a number of essential metabolic reaction suffer. Okay, now how they act. para-amino benzoic acid and the sulfonamide structure are assembled. They compete to the synthesis of folate acid. They inhibit to the folate acid synthetase, prevention formation of folic acid, does not form the new cell, and its growth should be start. Is act as a bacteriostatic. New cells should not form. They can inhibit the growth of bacteria. That is called the bacteriostatic. This is the mechanism of action. It is also known as Woods Fields theory. It is also known as Woods-Fields theory. That the mechanism action. This is the mechanism action. Okay. Are you understand? Mechanism action of sulfonamides. The some para-amino benzoic acid is a precursor product of to form the folic acid. Folic acid is responsible formation of new cell. And the para-amino benzoic acid convert to dihydrofolate to convert the tetrahydrofolate in the presence of folate synthesis, and it inhibited by the sulfonamides, preventing formation of folate. And next step is the tetrahydrofluoride convert to the folic acid in the presence of enzyme folate reductase. Okay. Now next, the human cell. See that reason as the human cell, human body cell use ready-made folic acid and hence, write down properly here, are not affected by sulfonamides. Human body cell ready-made folic acids does not affect the sulfonamide. The pus is rich in PABA, para-amino benzoic acid, that is called the PABA, and purines. Pus is rich PABA and the purine. Hence, sulfonamides are not effective in the presence of pus. Always ask the reason why the sulfonamide not effective against the pus. Because folic acid, PABA, some bacteria cannot absorb the folic acid, but depend upon their ability in the folic acid synthesis of folic acids from the para-amino benzoic acids. Then human cell having the ready-made folic acids are not effective sulfonamide, but pus is reached through the PABA and the purine, and then sulfonamide, when sulfonamide is given, it is not effective and the pus formation is increased. That's why it is not effective. Now most important is next, the sulfonamide structure is compared to the PABA. Now in sulfonamide show the antimicrobial activity. Sulfonamides show the antibacterial or antimicrobial either bacterial activity. How they are show? Now see the structure of sulfonamides. This is the structure of sulfonamide. This is the structure of sulfonamides. In the para position, these are ortho and this is the para position. That position having the SO2, NH2 and NH2 group. That's why it show the antibacterial activity. This position should be in the para position of the NH2 group, and the SO2 NH2 is the para position. Okay, that is show the antibacterial activity. Oh, okay. It show the antibacterial activity. Because of the para position, it show the hence is not in the para position sulfonamide group and the amino group NH2 group, that is does not show the antibacterial activity. Understand? Now how the structure is compared to the benzoic acid, para amino benzoic acid. Is the benzoic, is the NH2. Now this is the para amino benzoic acid. The structural compared to the enzyme folate synthesis, and the PABA is reaches into the pus cell reaches to the PABA and the purine, and then it is not effective in the sulfonamides because the structural similarity. In the pus reach in the PABA and the purine, and the sulfonamide is not effective because the para amino benzoic acid is a precursor product of the folic acid, and folic acid formation of new cells, and the human body having the ready-made body cell having the ready-made folic acids, it's not effective. Now next part of that is the mechanism action is over. Sulfonamide resistance. Okay, resistant to the sulfonamides. Next part should be the resistance to sulfonamides. Sulfonamides is most common and most bacteria are capable develop to the resistance. The resistance to the sulfonamides, the following pathway. Increase the production of, it's a following pathway. Which are the pathway? कौन सा है? These are increase the production of PABA. Second, the folate synthesis. Their folate synthetase enzyme having low affinity, because low affinity of the sulfonamide. And third, adaptation of alternate pathway of folate metabolism. Adoption of alternative pathway metabolism. Which folate metabolism? Now these are the pathway and resistance is developed to the Staphylococcus streptococci, pneumonia cocci is developed the resistance to the sulfonamides. Now next, the adverse effect. Or side effect. The first, it cause hyper sensitive reaction. Is the most common adverse effect of sulfonamide is hypersensitive reactions such as rashes, skin rashes, angioedema, swelling in the. See, the adverse effect of sulfonamides, hypersensitive reaction is most common: skin rashes, angioedema, drug fever, Stevens-Johnson syndrome. It's occur because due to the long-acting agents of sulfonamides. It's the most common adverse effects is occur crystal urea, because due to the nephrotoxicity they produce the crystal urea, and you minimize the crystal urea intake of the water, much more water and urine make alkaline, and crystal urea is minimized. Sulfamethoxazole and sulfoxazole is soluble in the water, is a minimum side effect of crystal urea. Due to the hemolytic disturbances is cause hemolytic anemia and agranulocytic cytopenia. Granulocytic cytopenia is occur, and the thrombocytopenia can and thrombocytopenia is occur. Okay, and its miscellaneous adverse effects is affected the hepatitis, hypothyroidism, inflammation of liver, hypothyroidism, less iodine, arthritis, nausea, vomiting, and it cause the water. Now the next should be the classification of sulfonamide. Now it should be the classification, preparation and dose. First, short acting drugs. It's rapidly absorbed and rapidly excreted through the urine of sulfonamides. Duration is 3 to 4 times in a day. 3 to 4 times in a day. For systemic infection. Their duration is short. Now the example of that: sulfonamide sulfonamide. It is used orally or intravenous route. Dose is given 2 to 3 gram followed by 1 gram 4 to 6 hours. Now this way is given. Sulfadizine is effective orally and it is given intravenous 2 to 3 gram followed by 1 gram 4 to 6 hours. Another example, sulfoxazole. It is given intravenous route only, IV. It is given IV. Dose should be given 2 to 4 gram followed by 1 gram 4 to 6 hours. Okay. The next example is sulfomarazine. It is given intravenous route is IV. Dose is same. Dose is given 0.5 to 2 gram TDS. You know the long form of TDS. Don't give an intravenous. 3 times in a day. Okay. Next should be second classification. Intermediate acting drugs. It's rapidly absorb and excretion. Duration is 18 to 16 hours. Example of that drug is sulfomethoxazole. Initial dose is 2 gram. Then is given 1 gram every 12 hours. Initial dose is 2 gram and afterwards is given 1 gram every 12 hours. Sulfomethoxazole orally. Next should be sulfaphenazole. Initially dose is given 1 gram, then is given 0.5 gram every 12 hours. That is intermediate acting dose. And third, long acting sulfonamides. Lasting is 1 to 7 days. Duration is there 1 to 7 days. Example of that, sulfadoxine. Another example, sulfomethoxazine. Sulfomethoxazine is given initial dose is 1 gram and followed by 0.5 grams once in a day OD. Then sulfamethoxypyridazine. Sulfomethoxypyridazine is given, dose is same, is similar dose is previous one. Okay. Now these are and another sulfonamide for topical use. sulfacetamide, sodium are used in the topically for ophthalmic preparations. Silver, another drug is silver sulfonamide. This drug is against used in the burns. It is used for ophthalmic. Then another is mependine. Drug are used topically. It is used topically. Effective against the pneumonia spider. It is used in the dressing prevention to the infections. Okay. Now the last part of that is therapeutic use. So many times asked therapeutic uses. Therapeutic uses of sulfonamide. It is most commonly used in treatment of urinary tract infection. Tract infections. Most commonly used sulfonamides is high concentrations. Second, it is used in treatment of meningitis. Sulfadizine, the drug are used when inflammation of the brain. Sulfadizines are used. Third, it is used in the treatment of bacillary dysentery, those caused by these microorganisms, bacteria, bacillary dysentery. It is used in the treatment of pharyngitis, inflammation of pharyngitis, and the gum infection. You know the gum above the teeth, they are having the gum, should be the swelling and then cause. It is used in treatment of trachoma and conjunctiva. Trachoma and conjunctivitis. Local application of sulfacetamide. It is sulfacetamide are used. Okay. Now these are the text.